Today we're going to talk about the heart. It's the pump of the system. Heart disease is the #1 killer in Americans today. When a heart attack happens, the oxygen supply to the heart stops. The heart loses fuel, which is oxygen. It will stop pumping blood to the brain. After 45 seconds of no oxygen supply, you will become confused. After no oxygen supply for 3 to 5 minutes, your brain becomes dead.
There are many reasons for chest pain, but the threshold to suspect a heart attack should be kept low. You should not think that a heart attack is an extraordinary claim so that you need extraordinary evidence to prove it. Most doctors will keep their suspicion threshold low. The first test the doctor will do is an EKG and a blood test, and they run a panel of tests to rule out or rule in a heart attack.
The nature of heart attack is hypoxic attack.
Life is where blood flows. When the blood supply stops, there is a problem.
A heart attack is when the coronary artery gets blocked. When you have a heart attack, your coronary artery can become partially blocked or fully blocked.
Hi, I'm Grace and I'm from California. As some of you might know, I almost died from septic shock in my arm. And today I want to tell you a few things. I risked my life, but you don't have to risk yours. I'm 5'4" and 105 pounds, but to a little ant or a little bacteria, I'm huge. I'm the whole universe. Almost too big to die. Kind of like you as an individual, maybe 150 pounds, how you look at the mass of the whole human population, maybe 120 billion pounds. They look too big to die to us, just like you are too big to die to a little ant. I risked my life, and I'll tell you this, that's not true. Nothing is too big to die. Natural pacemaker. It is most commonly located right here in the junction between the superior vena cava and the right atrium. This natural pacemaker regulates the heartbeat through electric currents. When you have a heart attack, it disrupts these electric currents. The heart attack affects the electric current that regulates the heartbeat. The worse the heart attack, the more the electric pattern deviates from normal. And a panel of blood tests that includes cardioenzymes.
Coronary artery is so-called alive. It can be constricted if stressed out, and that can make your heart attack a million times worse. That's why we have a stress test. There's a chemical stress test, and then there's a physical stress test. Chemical stress tests are often associated with imaging, such as an echocardiogram.
Doctors to look at the blood supply, they use contrast to make them visible on an imaging test. The medical contrast is kind of like hair dye to highlight your hair and make it more visible.
Blood bank inside of our body has an oxygen reserve. That's why it can stay living a little longer on the blood bank's oxygen reserve. During that reserve time, it's our time to jump in and save lives. Cardio cath lab, it's known as the door to balloon time for the hospitals that have cath labs. The door to balloon time that's acceptable in this country of the United States is 90 minutes. When a heart attack happens, the coronary artery usually isn't all the way blocked off, so you still have time to make it to the hospital. It is known as the window of opportunity, and it gives you a chance to save your life. The time for door to needle in medicine is about 30 minutes. or oxygen deficiency diseases. Timing is everything. If you miss the timing, you miss the opportunity to save lives. When heart attack and stroke patients stay living, they come back with residue symptoms.
Another priceless gift for you. I risked my life so you don't have to risk your life. Have your life bankrupt, not even once. Let's just say bankrupt a second or third time. In human court, there is a bankruptcy law that you can take advantage of so that you can spare your misfortune. In the court of nature law, there is no bankruptcy code to protect you.